Welcome back. Joining us now on set is Robert Zirkelbach, Chief Public Affairs Officer for Pharma. And joining us remotely is Spencer Kimball, Executive Director of Emerson College Polling. Spencer, let me start with you. You conducted this poll for Real Clear Opinion Research. Give us your top lines and walk our viewers through some of the important findings.
Thank you, Tom, for having me. When we take a look at these results, the economy is by far the most important issue for voters. 1 in 3 reported that as what's driving their vote. Secondary issues are like immigration at 13%, abortion around 11%, and then threats to democracy at 10%. But the economy and pocketbook issues are really driving voter attitudes. So when we asked about healthcare issues, they're primarily focused on their out-of-pocket expenses and the cost of premiums. And then finally, as we look at some of the barriers that voters are having with their health insurers, they're looking at being excluded from some coverages or needing prior authorization for access to some coverage. And then step therapy, again, is another area where voters are concerned about how the insurance companies potentially slow down the process for their care. And so ultimately, economic concerns are paramount to these voters, and then it's driven within the data. For example, 94%, an overwhelming number, would like to see health insurers and middlemen pass those rebates and discounts directly to patients.
Robbie, what about the findings jumped out to you?
Yeah, first off, thank you for having me here today.
Absolutely.
And I think, as Spencer noted, the healthcare story is very similar to the economic story. These are pocketbook concerns for voters and for patients. And what they care most about is what is their experience like when they go to the pharmacy counter to get their medicine, or when they're dealing with their health insurance coverage, trying to get a medicine approved that their doctor says that they need. And what we're seeing is that the sheer number of people who are experiencing some barrier to getting their medicines is really surprising. If you look at the statistics in the poll, 60% of voters said they or someone they know has experienced some type of insurance barrier, whether their medicine wasn't covered, they had to go get prior approval from their insurance company to get the medicine that they need, or they had to try another medicine and fail on it before they could get the medicine that their doctor says they need. That's what's really animating a lot of voters' healthcare concerns. And I think you contrast that with a lot of the policy conversation we've had in Washington that's been primarily focused on how do we save the government money, and how do we try to lower healthcare costs for the government without actually addressing the real pain points that voters say they care most about. And that's what they're looking for from policymakers.